My name is Gwendolyn Caleb. My patient is Miss S.G., a 59-year-old African-American female, presents to the clinic alone. Her chief complaint is feeling sad, feeling down. She's feeling like she's in a deep hole and can't pull herself out. She's feeling hopeless, helpless, angry, guilty, and shame. Her HPI, Miss S.G. complains of feeling lonely, feeling hopeless, helpless, angry, guilty, shame. This has been going on now for about the last 3 to 4 months due to the loss of her brother. She also complains of chest heaviness, palpitations, and tachycardia. She says she's presented to the emergency room several times, and the emergency room doctor is not doing anything to help her problems. He's doing cardiac workups, and that's about it. What makes her feel better is when she's around other people while she's at work. What makes her feel worse is when she has to go home to an empty house by herself and she has no one to talk to. Her medical history is hypertension, in which she takes Norvasc 10 milligrams daily. Constitution-wise, she is complaining of some fatigue. She's complaining of decreased appetite, along with weight loss of 20 pounds over the last 3 to 4 months. As far as she's feeling fatigue and she's unable to maintain eye contact. So she does complain of tachycardia and chest heaviness and palpitations. So I did listen to her heart. I did not find any extra heart sounds. I did not find any swishing or any murmurs. I did not see any shortness of breath. I did listen to her lungs because she does complain of shortness of breath at times. Her bilateral breath sounds were clear to auscultation, both anteriorly and posteriorly. And as far as the heart rate, her heart rate is 112. Her differential diagnosis would be bipolar, obsessive compulsive disorder, and OCD and depression. So with the OCD, people experience a lot of just wanting to do everything perfect. They're obsessed with doing everything, and they are extremists. With the bipolar, they have their high lows. One moment they're up and down with lots of energy, feeling hopeful. Then they would drop off into a state of depression. And with the depression, Miss SG is experiencing some feeling sad, like she's in a deep hole, can't pull herself out. She's feeling hopeless, helpless, angry, guilty, and shame. So I'm going to diagnose Miss SG with depression/anxiety. I'm going to start her on some Lexapro 10 daily, some Buspar 7.5 BID, and I'm going to put her on some Periactin 4 milligrams because she is complaining of decreased appetite and weight loss of 20 pounds over the last couple of months. There are no diagnostic tests ordered at this time, and there are no referrals. Should Miss SG use some non-pharmacological interventions, this may help her with the depression. She can maybe join a support group. She can do some aerobic exercises. She can do away with alcohol and cigarette smoking. She can also do away with caffeine, which includes coffee, chocolate, and sodas. Should she experience some worsening symptoms, she can return to the clinic. If not, she can return to the clinic in 4 weeks for evaluation.